Hey guys, it's David again. I just wanted to say thanks so much for all the feedback that everyone's given with regards to the last video that I posted. Truly, all the messages, all the comments, all the well wishes, that speaks volumes, and I truly appreciate it. But more so, I know and I hope I can speak for all other healthcare workers, the city of New York, everyone here that's affected by COVID-19. We thank you for everything that you've said and all the support you've given us. Thank you for sharing this video and raising awareness about what's really going on. I really wanted to give everyone a clearer picture of what we're really experiencing here in the hospitals in New York, and I hope this continues to do so. But in response to my last video, I got a lot of questions and a lot of feedback that I kind of wanted to respond to and help clarify and answer any questions that other people may have. One of the questions that I got a lot was what specifically scares you about this? Or what specifically scares the healthcare system about what's going on? And I know that's not a single word answer. There's a lot of things that scare us about what's going on. I spoke a little bit about how overwhelmed we are at the hospital. And that's not just at the hospital that I work at. That's all the hospitals here in New York. The amount of cases that we're seeing on a daily basis is enormous. The amount of cases that decompensate so quickly is just as high. It's real that in the last few days we've had what seems like an intubation, a rapid response, a code blue every hour to an hour and a half. That's a lot. I spoke with one of the emergency room residents recently, and they had told me that in one day alone, they intubated 16 patients in the ED alone. And on top of that, on the floor, there were maybe about 10. That's scary. Just by adding all those things up, you see how many ventilators we need. And those resources are quickly running out. That talks about ventilating 2 patients with 1 ventilator, the talk about ventilating patients with BiPAP machines, that's going to become a reality. That's scary. When you talk to doctors and nurses that have been in this field for so many years, and they tell you that they're scared, that they've never seen anything like this, and that they can see how overwhelmed the system is going to be, more than it already is, that's scary. The amount of pressure it puts on the system in terms of providers, with all the people decompensating you need people to manage these patients. And these are all critical ICU level patients. And if you don't have enough staff to manage all those patients, like, you can only imagine what the outcome will be. That's a scary thought. Another question that I got was if there were any updates as to our situation here in New York. I mean, I can only speak to what's being updated, or what we're being updated about at our hospital. Yeah, I mean, that kind of goes along with the first question too. There's still a lot of resources that we need. The hospital is making changes constantly to keep up with the demand and also the lack of supplies. You know, like, just our PPE resources are, you know, decreasing by the day. We're being asked to reuse masks, which, you know, can kind of compromise our safety. We're being asked to work more hours, again, which can compromise our safety and patient safety. Our hospital's done a lot to move things around. And by that, I mean, our hospital has canceled all elective surgeries. And effectively, they've made the surgical ICU now a medical ICU because of the overflow of patients. They've converted our step-down ICU unit into a 30-bed pure COVID ventilator unit. I mean, if that doesn't say overwhelming, I mean, I wish you could walk through these units and see what it's like. And I wish you could walk through the ED and see what it's like. Because it's not normal. And it's not calming by any means. So that's just kind of how it is right now. Another question that I got was about social distancing and how important is social distancing? You know, some people were asking, there's not many cases in my city right now. Like, why do I need to, you know, socially distance? And like, to that point, socially distancing isn't really about you. Social distancing is about the people around you. The point of social distancing is to, you know, as so many people have said, flatten the curve. By flattening the curve, that means not overwhelming the system so that we're at a point where we can't treat everyone that needs to be treated. And as I talked about before, that's where this is headed. That's what we're experiencing now. And even though your city isn't experiencing that, does not mean that it won't. By socially distancing, you are preventing that. Again, I wish you could walk through the units at our hospital. I wish you could walk through the ED at our hospital. We don't want this. You don't want this. We don't want to have to choose who gets a ventilator and who doesn't. And if this happens in your city, you don't want the doctors at your hospital having to make that decision. So again, social distancing isn't about you. It's about the people around you. I mean, I was reading on one of a fellow provider's notes about COVID-19 and the effect that it's having and what social distancing is doing. And she came up with a really good example. So say you have COVID-19 and your symptoms are really mild. You don't even really feel sick. Because for some cases, patients don't feel sick for the first, 10 to 14 days. But say you have it. And say you don't socially distance. And you visit your family. And you visit your friends. Just a couple of them. But with some of those family members and with some of those friends are their kids. Or are their grandparents. Or their parents. These people don't have the immune systems that you have. And even though your symptoms are mild and don't even appear for the first 10 to 14 days, they get COVID-19. And their symptoms do. And their symptoms get worse. They develop cough, fever, shortness of breath. They go to the hospital. And the hospital's like ours. They decompensate. And they require a ventilator. But there aren't any. They have to share a ventilator. It can happen. But we prevent that by social distancing. It's a simple concept that prevents a lot of disasters. It's a simple concept that will prevent a lot from happening.